I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press the bell icon button, then you will receive all my latest videos. Today I'm going to talk about the meningitis. Meningitis is a medical emergency. Meningitis is the infection or inflammation of the meninges. Meninges are the protective membranes covering the brain and spinal cords. The inflammation is usually caused by an infection of the fluid surrounding the brain and the spinal cord. That is why it is a life-threatening disease and it is a medical emergency. Meninges is the system of membrane which envelops the central nervous system. It has three layers. Number one, it's a dura mater, arachnoid matter, and the third one is pia mater. So subarachnoid space, what is the subarachnoid space? Subarachnoid space is the space which exists between the arachnoid and the pia mater, which is filled with the cerebrospinal fluid. There are several causes of meningitis. The most important are infective or non-infective. So in infective causes, bacteria are the most common causative agents. Second, viral. Third, fungal. Meningitis is also caused by parasites or protozoa. Physical injury, for example, trauma, cancer, certain drugs, mainly non-steroidal anti-inflammatory drugs, head injury, trauma, cerebral abscess, as well as middle ear infection. So in bacterial meningitis, the most common causative agents, what we see in clinical practice, Haemophilus influenzae. Haemophilus influenzae incidence is nowadays low because of the high uptake of meningitis. All the children are vaccinated against Haemophilus influenzae. But with the passage of time, immunity goes off. So adults or older people, they are at risk of suffering with Haemophilus influenzae meningitis. Listeria, again, people who are elderly or with cancer or with weak immune system, they are at risk of suffering with listeria. Meningococcus, pneumococcus, and certain streptococcus as well. And if there is any prosthetic material in the brain, for example, a VP shunt, then they are at risk of suffering with staphylococcus infection as well. Now we talk about different viruses. Enterovirus meningitis is very common in mothers or young females. So mothers, because their babies excrete enterovirus in the feces, so whenever they take care of their babies, so they acquire enterovirus and suffer with enterovirus meningitis. Arbovirus, mosquito-borne illnesses, influenza, herpes simplex, especially in infants, elderly as well, varicella zoster virus, HIV, mumps, measles. In fungus, people with weak immune system or HIV or AIDS, they are at risk of suffering with Cryptococcus meningitis or Candida meningitis. In addition to these, we also see many cases of meningitis due to histoplasma mucormycosis as well as aspergillus. The most common parasites which could cause meningitis or meningitis-like picture, toxoplasma, hydatid, amoeba, plasmodium, as well as cysticercosis. So who are at risk of suffering with meningitis? Children, for example, less than 5 years old, or elderly more than 65 years old. People who receive immunosuppressive drugs, to suppress their hyperactive immune system. Chronic malnutrition who are really weak, AIDS. If there is any prosthetic material, for example, CSF, cerebrospinal fluid shunt, chronic alcoholism, people who are diabetic, or people who already have different kinds of diseases, for example, cancer, etc. So how, whenever any organism, bacteria or virus, enter into human body, then they reach to the blood circulation. So after crossing the blood-brain barrier, they reach to the meninges, or if they reach to parenchyma, then they cause encephalitis, and then they cause inflammation or infection over there. So intracranial pressure or pressure in the brain would be increased due to this infection. So infection is usually in the subarachnoid space and pia mater. So that's why so I will talk about obtaining CSF for culture and sensitivity. So that's why CSF becomes cloudy, high white blood cell count in the CSF. So what are the signs and symptoms of meningitis? Severe headache, neck stiffness, irritability, patient is restless, malaise, nausea, vomiting, and especially projectile vomiting, high-grade fever, raised respiratory rate is increased or increased respiration, fits, patient does not know where the patient is, increased heart rate. Some patients, when they come to the hospital, they are already in coma. They experience sleeplessness, photophobia, phonophobia. They are usually confused. So how the doctor diagnose meningitis? First of all, doctor will take a detailed history, will examine the patient, will see if there are any red spots on the body or any other clues which are suggestive of, for example, signs and symptoms suggestive of meningitis. So then different tests will be done. For example, as I mentioned earlier, so fluid, cerebrospinal fluid is taken. So the needle is, or syringe is inserted in the spine at a certain level. So doctor knows where to insert. Then CSF is withdrawn, provided there is no contraindication and the pressure in the brain is not prohibiting to postpone this test. Then this CSF will be sent to the biochemistry lab as well as microbiology laboratory for further testing and processing to check what organism is causing meningitis. Then doctor will also do imaging, for example, a CT scan, blood tests will be done, blood samples will be sent to the hematology laboratory as well as biochemistry laboratory, blood culture, a throat swab, and in some cases MRI is done as well. There are certain typical signs and symptoms. As I mentioned the symptoms, there are some signs as well. When doctor will do examination, then they will check the Kerning sign, whether the Kerning sign is positive, and also Brudzinski sign. They will also check the neck rigidity. Meningitis can cause serious complications. For example, brain damage, cerebral edema, hearing loss, tissue damage, loss of limbs as well. Treatment is based on the causative agent. Antibiotics will be given because every hospital has a standard protocol how to treat meningitis how to manage infection control measures as well as prevention. So the antibiotics will be chosen according to the causative agent. For example, if meningococcus Neisseria meningitidis is causing meningitis, then third generation cephalosporins, or Streptococcus pneumoniae, third generation cephalosporins. So according to the causative agent, antivirals are usually not helpful in meningitis, but antivirals are indicated in encephalitis. Other medications, for example, if the pressure, intracranial pressure is raised in the brain, then it will be lowered down and fluids will be given to reduce the swelling, as well as doctors or the team will manage the seizures. If fever, then paracetamol to reduce the fever. Nursing care is also very important in meningitis. Infection control measures are very important because some organisms are really contagious, so can transmit to healthcare workers or to other patients in the hospital. So the patient will be isolated and all measures will be taken appropriately. Prevention is very important, as I have mentioned earlier. So children receive vaccination for Haemophilus influenzae as well as pneumococcus, and other patients who are at risk of meningitis, they also receive different vaccines. For example, Haemophilus influenzae vaccine, pneumococcal vaccine, meningococcal vaccine, or people who travel for pilgrimage to Makkah, they also receive meningococcal vaccine. People who come in contact with patients with meningitis, so they will be risk assessed. Health protection team or the local team, they will decide about the prophylaxis of all patients who come into contact with meningitis. Thank you very much for watching this video. If you have any question, please write down in the comment section. I will answer all your queries.